When the COVID-19 pandemic struck Kenya in March 2020, the country entered an unfamiliar phase characterized by a new way of life. The fast spread of the virus and the requisite complicated treatment procedure badly exposed the inadequacies, I beg your pardon, in the country's health sector. But even as the disease claimed lives of patients and medics as well, corruption still reared its ugly head, more so in the procurement of equipment to combat it. Nancy Okwari looks at the impact of the pandemic on the health sector.
I said that as far as coronavirus is concerned, it is not a question of whether. It is not a question of if we are going to get a case in due course. It was a question of when. And members of the press and fellow Kenyans, I want to inform you that the Ministry of Health has confirmed the first coronavirus case in Kenya.
It is this announcement by Health Cabinet Secretary Mutahi Kagwe back in March that asserted one of Kenya's worst fears, that the invisible enemy that is COVID-19 had penetrated through our borders. At that moment, Kenya was still struggling to build its testing capacity and was initially forced to transfer samples to South Africa for testing. With the first case already confirmed and isolated, the Ministry of Health surveillance team embarked on contact tracing, and it is from this one case that more COVID-19 cases were confirmed as testing intensified. The public's uproar over the low testing capacity prompted the government to embark on a mass testing exercise that targeted highly infectious areas. Tents were erected at various points where willing Kenyans walked in for their samples to be collected. But this did not help much because the delay of up to a week in getting the results proved risky as positive cases learned of their status after interacting with several others.
Tunapima COVID, matokeo hayatoki kwa wakati. Nimekaa 1 wiki na siku 2, sawa. Mpaka leo ndo majibu yamekuja.
The government therefore abandoned targeted mass testing even as a shortage in reagents for testing hit hard.
We are experiencing, as we've mentioned, disruptions in terms of reagents, being able to get those supply chains sorted. But this is something that we are managing. Camry next week will actually be getting a batch of reagents coming in, and so this situation will normalize by next week.
Whereas infection soared, the cost of COVID-19 tests proved prohibitive for most Kenyans. Over 9 months since the pandemic struck, Kenya has managed to run over 1 million COVID-19 tests. Quarantine for those that had traveled from abroad or tested positive became mandatory, but these two proved too expensive, with suggestions that part of the COVID-19 emergency funds cater for the quarantine falling on deaf ears. Some of those accommodated at the Kenya Medical Training College Quarantine Center opted to escape, and so did a few others at such centers. Despite the containment measures, Kenya seemed to be losing the war against the pandemic as infections became rife at the community level, prompting the government in frustration to call for individual responsibility.
To keep COVID at bay and still be able to live and lead a normal life. I only wish that this issue of personal responsibility would be taken at heart.
It is citizen responsibility that can really help us in the containment measures that we are going to make. It is going to call for sacrifices once again. Sacrifices we can ill afford. But unfortunately, it is also sacrifices we have to make if we are going to save lives.
Social distance, na kila mtu anakaa kiti yake mpaka kwa daktari. Ukiingia lazima upimwe.
Kila mtu avae mask. Hakuna mtu anaingia kwa gari akiwa na mask.
Furthermore, counties which were themselves ill prepared to cope with the pandemic were urged to invest more in isolation centers and ICU facilities.
There will be no movement of patients from one county to another on grounds that if it escalates, if the virus continues to hit us in the manner that it is, it means that each county will have to take care of its own patients.
Well-wishers such as USAID came to Kenya's rescue with donations of ventilators as Kenyan youths rose to the occasion with local inventions of the gadgets that were critical to recovery of patients.
I'm able to integrate to create a logic that can synchronize both the machine and the human physiology.
What we are doing is designing and as well as printing some of the components and the connectors, as well as the assembly of the ventilator.
But even then, the rate of infections outstripped the bed capacity of hospitals in the country, forcing the government to advocate for home-based care, especially for asymptomatic patients who accounted for 90% of the infections. This saw the first batch of over 600 patients discharged from various health facilities to self-isolate at home in June.
From Kenyatta University, we have discharged some 338 persons who are positive for home-based care after the 14-day period recommended by the World Health Organization. From Coast General Hospital, we have discharged some 212 persons.
I must say we are happy in terms of the success that is going on there right now. We've had some discharges. I'm made aware of some success stories where some families have actually been able to go through that approach and now, are doing well.
The cost of caring for a COVID-19 positive case who is simply asymptomatic, if you had to put you here, for example, on average you'll spend 21,000 shillings just to monitor you without giving you any medicines, and 65% of that cost will be because of use of PPEs.
However, this cheaper option was only allowed for those who were asymptomatic or with mild symptoms, had access to a suitable place for isolation such as a separate room and washroom facilities, and had no pre-existing comorbidities. The government trained thousands of community health workers to liaise with the patients that were isolated at home and report to the ministry on their status. Sadly, though, is the toll the pandemic had on the country's frontline soldiers in the war against it. Healthcare workers in their tens succumbed to the virus, apparently in the line of duty.
Healthcare workers are being forced to continue working even when they have contracted COVID-19. This trend must stop. Healthcare workers are not robots. They're human beings. They equally deserve care.
This prompted demands by their various unions for adequate personal protective equipment and medical cover, and when these were not addressed, they went on strike. But even more despicable was what came to be known as the COVID billionaires, the corruption cartels who sacrificed humanity at the altar of greed as they gobbled billions of shillings from a dire situation.
That the cardinal principle of the law of evidence is that he who alleges must prove. Don't keep telling me that we have things to hide. Tell me what it is you're hiding.
Kindly don't lecture me.
Some top government officials at both Afya House and Kenya Medical Supplies Authority were implicated in the mega scandal where shoddy firms supplied COVID-19 preventive gear at outrageously exorbitant prices.
That the person who was giving out contracts gave out contracts to suppliers on prices that were higher than what is in the market, and in the process cashed in on this unfortunate pandemic to convert themselves into overnight billionaires.
Prices at which the goods cannot be viably sold in the market.
We could not go for all of them at Ago, so we have a first out procedure system that we finish this, then we go to the next until we finish. Everybody who was involved will definitely give account of what we did. But we have also recommended systems review of KEMSA, because they cannot afford to lose all this if they had a system that is basically able to prevent those kind of loopholes.
Kenyans can only hope that the ongoing investigations will bear fruit. With the COVID-19 pandemic having had negative effects on the health sector as well as the economy, Kenyans can only hope that things will get better into the new year. Reporting for Channel 1 News, I'm Nancy Okware.